So I thought I was going to be very cool by telling you about alpha-synuclein. Everybody knows about that, apparently. That protein that accumulates in the nerves in the brain that might precipitate or cause Parkinson's disease. But what I had no idea about was that this same protein that accumulates in the brain also accumulates in the GI tract and may be causing some of the diseases that I've been seeing for years. I really didn't know why these things were happening. So apparently this protein can accumulate in the submandibular gland and cause the drooling. It can accumulate in the esophagus, causing the trouble swallowing and eating food and liquids. It can accumulate in the stomach, causing something that I see all the time called gastroparesis, or inability of the stomach to empty out correctly. It can accumulate in the colon, where its accumulation is associated with constipation. But I did not know that it accumulates normally in the appendix to a large degree. And apparently in some studies, the release of that protein from a normal appendix might be one of the reasons why Parkinson's develops. I had no idea about that. But apparently the one little gland in my world, the appendix, is where that protein seems to accumulate normally. And apparently it's called disaggregation. It gets released in a soluble form into the blood and may find its way from the gut to the brain. And as maybe a cause or a contribution to its deposition in the nerves in the brain, causing those Lewy bodies to accumulate. Now, in my world, on a daily basis, it's not that I see many patients with Parkinson's who are being referred specifically for these GI issues. But I do see patients with these issues many times without Parkinson's, so there's crossover. One of the things that I see often is folks being referred because of aspiration and pneumonia occurring because of difficulty swallowing. Has anyone experienced that or had families, members experience that, aspiration? The problem with aspiration, of course, is that it can be lethal because when the secretions go into the lungs and cause pneumonia, patients can't clear those secretions, and those bacterial infections can be lethal. So we all know about swallowing therapists and swallowing rehab. Does anybody have any questions about how that should be tested? It's not actually by me. It's by a swallowing expert, where a formal swallowing evaluation is performed. Has anyone ever heard of that? Does anybody have questions about that? You had one. What was it like?
They made me drink a liquid in front of the x-ray machine and saw how it went down.
So that's exactly how it happens. They make you stand in front of a big old-fashioned x-ray machine, make you drink it down, right? And see if it goes where it's supposed to go, down to the stomach. Now, again, so I'm going to highlight important things in my day-to-day existence as a gastroenterologist. Was it abnormal? Did anything get into the lungs?
No, I was normal.
All right. So if it gets into the lungs, here's one thing I want to say from experience. So a lot of things you're going to learn from me are from experience, not from a slide. Don't let someone push you or push you for a family member to right away get a feeding tube into the stomach if the swallowing is abnormal on that exam. Why do I say that? Because swallow rehab personnel are trained to help people learn to swallow again with these neurologic disorders, including stroke, Parkinson's, myasthenia gravis. And in my experience, there's a rush to have people come to people like me to have us place feeding tubes into the stomach. Does anybody have a question what a feeding tube is? Have you ever heard of it? Yes. Well, we call it a PEG, or percutaneous endoscopic gastrostomy tube. And here's the problem with that. And I think some people will have experience with this. Once a person gets one of those tubes placed, they tend not to get as good care as they used to get. They don't get the same attention they used to get. They don't get the same attention to learning how to eat again and swallow. They're kind of left behind. And all the studies show that when you put in these feeding tubes for a stroke or Parkinson's, the mortality or the rate at which people pass away in the first 6 months is higher than if you don't do that. So I always try not to do that and try to help people get to the swallowing rehab folks first before we do that last step of putting the feeding tube in. Apparently, according to the studies, about 80% of people with Parkinson's have swallowing disorders long before they know it, long before they're choking or gagging at night. But again, don't be pushed into having these feeding tubes placed just because there's an abnormal swallowing exam. Now, the way I'm presenting today, anytime there's a question, just ask. I have no problem with that. Any questions about that little part of that? The second thing that I see a lot is gastroparesis. So we talked about the esophagus, the swallowing mechanism, but imagine the stomach being the size of a Nerf football. The food goes in naturally, the stomach expands, and what does the stomach do? It churns the food, puts it into little tiny, less than 1 millimeter particles, and sends it on its way. And usually within 3 to 4 hours, all that food you just ate is gone. So gastroparesis means stomach paralysis, meaning that the food that's in there is just sitting there and not being churned up and not being sent along. Now, I see this all the time in type 1 diabetics. There's also idiopathic gastroparesis where we don't have a reason. But according to what I read, it's very common in Parkinson's disease. Now, why is this a problem? Well, I learned in my reading for this that, of course, it's a problem because people have vomiting and aspiration if the food is hanging out there for too long. Well, what do I mean by too long? I've seen people with food in their stomachs for weeks. It never leaves, and it causes what we call a gastric ezowar, which is a collection of food the size of a grapefruit that will stay there for weeks at a time. Well, how do you know you have it? Well, there's an interesting symptom called early satiety, which really is a fancy word for I can't eat because I'm full all the time, because the stomach has actually expanded with that retained food. Well, what kind of food gets retained like that? Things that are supposed to be good for you, right? Carrots, celery, all those high fiber foods that everybody tells you to keep on eating, that's what gets caught in the stomach and doesn't get emptied out in gastroparesis. So I've seen that in my practice before. So what do I do when I see that? Well, I have to tell the patient, you've got to be on liquids for 3 or 4 days. Drink Gatorade and Powerade to sort of wash it through. But there's another trip, another medication that I'm going to tell you about pretty soon that's new on the market that in recent studies gets rid of that gastroparesis almost immediately. Now, the other thing I learned in preparing for this is that in Parkinson's particularly, gastroparesis is a problem because if the levodopa is not sent to the small intestine properly, you don't get drug levels of that medication. It gets absorbed in the small bowel. So if there's paralysis of the stomach or delay in gastric emptying, people have worse Parkinson's symptoms because the medication they're taking doesn't get to the small bowel for absorption. All right, so what kinds of foods make this worse, this gastroparesis? It's the uncooked vegetables, but the worst is the high-fat foods that we kind of all love. The cheeseburgers, the pizza with the pepperoni, the ice cream. The higher the fat content of the meal you're taking, the more the stomach will just stop working. That happens to normal folks. And anyone with any predisposition to that, like diabetics and Parkinson's, will have that situation even worse. So the stomach will just slow down and not empty out. Now, I was very interested to learn and read about something I see every single day in private practice as a gastroenterologist, and that's an infection in the stomach called Helicobacter pylori. Did anybody ever hear of that? Have you had it?
No, I was in the pharmaceutical industry.
Has anybody ever been diagnosed with it? Has anyone ever had an ulcer? Has anyone ever had gastritis? Does anyone have a family member with an ulcer? Does anyone have a family member with gastric cancer? Why am I asking all those questions? Those are the questions I ask people every day because that is a high suspicion for a bacteria living in your stomach that's been with us humans for 50,000 years. It looks like a cigar, it looks like a squid. It has these little flagella that make it move into the stomach lining. And it's a very tricky organism because it evades the immune system and it doesn't care that you're making stomach acid. It avoids it. Why is this important? Well, in my world, it's a cause of peptic ulcer disease.
Is that like H. pylori?
H. pylori.
Yeah, H. pylori.
H. pylori. So Helicobacter or H. pylori. It causes ulcers. It causes gastritis.
Right.
It's a World Health Organization type 1 carcinogen. It causes stomach cancer. But I did not know that in the world of Parkinson's, its presence also reduces the absorption of levodopa. So now, as a private practitioner, having read and prepared for this, if I see a patient with Parkinson's, even without symptoms, I might be testing for the Helicobacter pylori and treating it if I find it. Well, how do we test for it? We can either scope you and take a picture and some biopsies and look for it under a microscope. We can do a blood test looking for the antibody. We can do a stool test looking for the antigen, but no one wants to do that. I don't want to do that. So I never ordered that test, because that's terrible. But there's another test. It's a simple breath test where they make you swallow a pill, wait 10 minutes, and make you blow into a balloon. We all did that as kids, right? Blow into a balloon. And they take that air and measure certain compounds in that air, CO2. And if that's positive, you have the infection. That's the most accurate, non-invasive way to find out. So if you want to ask your doctors about Helicobacter pylori, ask, can I get the breath test for Helicobacter pylori? It's better than the blood test, it's better than the stool test, and it's non-invasive, and you don't have to be put to sleep like you would for a scope. All right, what if it's positive? Then we can treat it with antibiotics. You treat with 14 days of antibiotics. This is a tough bacteria to kill. Amoxicillin, Diaxin, and omeprazole, which is an acid blocker. Is anybody here allergic to penicillin?
Sure.
So if you have Helicobacter pylori and if there's an allergy to penicillin, you can't take the amoxicillin.
Right.
So we use Flagyl.
Flagyl.
Flagyl causes that metal taste in the mouth and makes you feel miserable. So we have ways to treat this no matter what your situation is. So if you have it, it should be treated because it apparently affects the absorption of levodopa and in and of itself is a cause of stomach cancer.
What are some of the symptoms patients will have?
So most patients with Helicobacter pylori have no symptoms at all.
Right.
But the symptom I see mostly is upset stomach. The fancy word we use is dyspepsia, bad stomach. Upset stomach, not feeling right. But an ulcer, or a family history of gastric cancer, or a family history of peptic ulcer is enough to get tested. If you go to Russia or China, 90% of all the folks have it. If you here in the United States, about 30–40% of everyone has it. If you go to Australia, only about 30% of folks there have it.
And why is that?
It's been with humans for 50,000 years, so we can actually track migrations of people from 50,000 years ago by looking at the Helicobacter serotypes. It's been with humans for 50,000 years, so it's all over the world.
Is there any kind of relationship between the food you eat and the incidence of Parkinson's?
No, you get it as a kid, hanging around with lots of kids in the family, person-to-person contact.
Really?
Because I was thinking of those societies that eat more fish than meat. Do they have a higher incidence?
No, it's just the higher incidence is Russia, China, India, Asia, Africa. The lowest is Australia, we don't know why. And the middle is the US. We don't know why that is.
Really? You don't know why?
No, we don't.
That's fine.
So this Helicobacter pylori story is something I deal with all the time, but I didn't know its special relationship in the world of treatment of Parkinson's.
Interesting.
All right, here's another one that I see all the time, and I'm going to give you some information I think would be very helpful. Has anyone ever heard of SIBO? S-I-B-O. Small intestinal bacterial overgrowth. Does anybody ever have an upset stomach or bloating? We all have bloating, right? So in our guts, in the small bowel and in the colon, there are not millions, not billions, but trillions of bacteria. Would you believe that there are 10 times more bacteria in our guts than cells in our body? So it's not crazy to say we're all very fancy hosts for bacteria, with nice hair and clothes and all of that. But sometimes those bacteria grow abnormally, and they overgrow. So small intestinal bacterial overgrowth. The highest concentration of bacteria in the colon, followed by the distal small intestine, where it connects into the large bowel. So everyone's heard of the microbiome, right? Probiotics, prebiotics, all that. When the bacteria in the gut overgrow, they don't really care about us. They do their thing. What do? They ferment carbohydrates. When they ferment carbohydrates, what's the byproduct of that? Carbon dioxide, methane, and gas and bloating. People get bloated, but that's not necessarily bacteria. Bacterial bloating is very distended, uncomfortable, and passing lots of gas. You can suspect there's a problem when you have that issue and this gas being passed all the time and it's malodorous. Those are the bacteria causing those compounds to be developed. Now, there's very fancy tests out there for small intestinal bacterial overgrowth, which I don't order and which I don't do in private practice because they're fraught with errors. There's one simple blood test that, if abnormal, is a very strong indicator that you have bacterial overgrowth, and that's a serum folate level.
Say it again.
Folate, F-O-L-A-T-E. So when you go to the doctor, and there's any suspicion that this might be happening, ask the doctor to order B12 and folate. They come together. Because the folate level, if it's greater than 20 or not measurable, is coming from bacteria because we can't do that naturally. So the bacteria are making folate on their own if they're overgrowing, and that can be measured in the blood as a folate level that's way too high. That's a strong enough indication if someone has gas and bloating and high folate that intestinal overgrowth is the problem. All right, what if that's present? Well, according to what I read, it decreases the absorption of levodopa. So if you have that, you won't get the medicine blood levels you need, according to what I read. So how do we treat it? All right, I'm going to give you the name of an antibiotic that gets rid of this in 1 week. The problem is not the antibiotic. It's unbelievably effective. The problem is that insurance companies give me a hard time all day long about ordering it for you. Because it's expensive because there's no generic. It's called rifaximin. R-I-F-A-X-I-M-I-N. It's a special kind of antibiotic that doesn't get absorbed into the bloodstream. It stays in the gut and kills off billions of bacteria. If those bacteria are killed off, the gas and bloating goes away. It's 200 milligrams 3 times a day for 1 week. Most patients, if this is the condition, will feel better immediately. Well, do you have to do it again? Yes, the bacteria will grow back again. Usually in about 3 to 4 months, you have to do it again. Out of pocket, that medication is something like $800 for that 1 week course. You can get it in Canada. I have patients who've done that. But you have to get your doctor to really try to get it authorized for you and go through that pre-authorization, prior authorization process, which is a pain in the butt for everybody. For me, as a doctor, staff hours of time to get that done is very time consuming, but it can be done. You will notice that the gas and bloating goes away, and maybe, I don't know because I don't have the experience, maybe the drug levels improve and maybe the Parkinson's symptoms improve. All I can say is the studies have shown that. I don't have personal experience with that. Anybody have questions about this small intestinal bacterial overgrowth story? All right, the last one is, I'm going to give you lots of information here from my personal experience, and that's constipation. So I see patients with constipation all the time. But there's something special about Parkinson's patients with constipation that I did not know prior to getting ready for today. Maybe you guys knew this, but I didn't know that constipation could predate the neurologic symptoms of Parkinson's by 15 years. Is that common knowledge? I'm the only one that doesn't know that. I didn't know that. That's remarkable. So basically, there are two kinds of constipation in my world. Either the colon is not moving things along, it's about 6 feet long, or it's moving things along just fine, but the muscles of the rectum and the anal canal aren't working correctly to let you pass it. One is called slow transit constipation, and one is called dyssynergic constipation. So let's talk about the slow transit one first. That means the colon is sluggish, and in Parkinson's, that alpha-synuclein that everybody knows about except me, apparently gets deposited in the neurons of the colon and causes a slow transit constipation, meaning you don't pass things in a day or two, it could be there for a week. All right, so there are medications I use all the time for constipation. You may want to write it down because it's not commonly known. These are not the laxatives and the stool softeners. These are prescription medications. One is called Linzess, Linzess. Anybody heard of that one? That one's once a day.
Can you repeat it again, the spelling?
Lin like Nancy, Zess. And patients ask me, well, what does that do? I tell them it's a little bit of cholera. So when children get infected with cholera, you hear about children dying of diarrhea. It's the cholera toxin that's causing a certain protein in the small intestine to go crazy and secrete liquids uncontrolled, and the poor kids get dehydrated quickly and die. That's the toxin doing that. But this Linzess is a controlled cholera infection. It causes the same stimulation, the same protein level on the small intestine to secrete just the tiniest amount of liquid into the gut. But if billions of cells are doing that, then the patient feels better, there's more liquid in the stool, and patients have more frequent bowel movements. So that's Linzess. That's by prescription, it's once a day. You don't take it as needed, you take it every day like a vitamin. It's very effective. The goal is to have movements up to 3 times a week is the normal. You don't have to have movement every day in these studies. It's up to 3 times a week. All right, the other one is Amitiza, 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 which also acts a little bit like cholera. It's a secreting molecule. And is one better than the other? No, it all depends on insurance. So if it's constipation, which is less than 2 movements a week, then you can ask for a prescription of Linzess or Amitiza.
What about an enema?
Enemas are fine for the anal rectal dysfunction. We're going to get to that. Yeah, that's okay. Magnesium citrate is okay. But I want to tell you about a new medicine that's even better than those first 2 I told you about. That was just recently FDA approved for slow transit constipation, and that's called Mote Equity. M like Mary, O, T-R-E-G-I-T-Y. Mote Equity.
I want to know what you're supposed to do for when you have constipation and diarrhea.
Yeah, we'll get back to that.
You can't just.
That's my life. All right.
This over the counter?
No, so Mote Equity is all 3 of these are by prescription. I like this Mote Equity better than the other 2 in this particular situation because this one doesn't work by putting more liquid into the stool. This one works by improving the contractions of that slow transit colon. It invigorates the colon. It causes this, it stimulates contraction, so things will actually move normally, rather than having the number one side effect of those other two medications, which is loose water stool. Now, let's go back to the gastroparesis, the stomach not working. There are medicines for that, but one of those medicines is absolutely contraindicated in Parkinson's, and that's Reglan. Has anyone heard of this Reglan?
Reglan?
Reglan, R-E-G-L-A-N. If anyone tells you to use that in the setting of Parkinson's, it's contraindicated. It makes Parkinson's worse. I don't even use it in non-Parkinson's because it has so many side effects. One of them is Parkinson's-like facial movements, and the other one is called tardive dyskinesia, where there's a movement disorder that's permanent. It happens. So this Mote Equity is FDA approved for constipation, but in a very large study of diabetics with gastroparesis, almost every one of them got better. Because it also hits the same receptors in the stomach as it does in the colon, and that stomach that's just laying there being lazy starts getting invigorated again. So it helps with that gastroparesis, and it's FDA cleared for constipation. So I use it off-label for gastroparesis, but I tell you that for my office. All right, there's another medicine that used to be on the market that's back on the market called Zelnorm, Z-E-L-N-O-R-M. You can only get it through a gastroenterologist because, as happens all the time, in the studies, the medicine worked beautifully. But when it went out into the world, people were having heart attacks. That's a problem. People were having ischemic colitis, all sorts of complications. So now it's back on the market in what's called a controlled situation where you have to see a gastroenterologist like me, and I have to make sure it's safe. Now, there used to be a medicine called Propulsic, or Cisapride, which was just like these other medications, great for gastroparesis, great for constipation. In the studies, it was wonderful, but guess what happened when it went out into the world? Cardiac arrhythmias. People drop it from ventricular fibrillation from that medicine. So if there's anybody with a cardiac condition or AFib or any condition like that, no one should be putting you on any of these medications unless we understand what your EKG looks like.
Oh. How many gastroenterologists really know about these drugs?
Only one, me.
Because very often, you have to check with the pharmacist rather than the doctor. About, like when you get a prescription or whatever and you want to make sure, and you just call the pharmacist that you're dealing with or whatever, and you ask about it and they know more. I really would like to know, because I don't think every doctor knows about all these. For Parkinson's, I mean.
Again, I'm telling you, I didn't know much of this prior to getting ready for today, because it doesn't come into my office a lot.
Right.
Now, so you can hear that I know a lot about these things in general. I deal with it every day, but I wasn't quite aware of these specifics to Parkinson's. Again, about the lack of absorption of the medication, this alpha-synuclein being deposited into the brain, maybe from the gut, the H. pylori. I didn't know this until I read about it.
Right. So would you suggest that as Parkinson's people, either caregivers or patients ourselves, we need to be aware of it and we need to question the doctor and we need to check on it?
Absolutely, because I'm telling you, I know my friends.
I know.
They don't know this.
I know. I'll tell you who does tell me. My daughter's a physician. When I run things by her, she sends me everything.
So again, in my world,
So
in
you have to-
gastroenterology,
yeah, you have to
it's
really know.
impossible for me to know everything. But I really learn when I have to know it to present it to people. So this is very interesting information about the Parkinson's and the gut. Now, I just wanted to tell you that if you imagine the small intestine such as a garden hose, it's around 25 feet long if you took it end to end in your gut. So imagine that outer line, and every inch there's a marble in that outer green line, a marble. In the gut, that's the nerves of the gut making the small bowel act like a snake and moving things along. That's called the enteric nervous system. Those little marbles are nerve collections that make our guts do what they're supposed to do. We don't even think about it. You're listening to me, it's happening right now. What I did not know was that in Parkinson's disease, that migrating motor complex, that contraction downstream, like a snake going through the field, is disturbed greatly. So instead of the snake going through the field, he's going back and forth and going nowhere. The contractions are not coordinated because the enteric nervous system apparently is infiltrated by that crazy protein, that alpha-synuclein. And those nerves don't work correctly. So that's a contributor to that small intestinal bacterial overgrowth I was telling you about. Because if the garden hose isn't getting things through properly, the bacteria are having a wonderful time just hanging out and growing. So do you think my friends know that? I don't think so.
See, that's the issue, yeah.
I know, but I tell you, it's easy to understand from my point of view. I deal with this all the time. I just never understood the specifics to Parkinson's because we don't see it a lot. So these medicines I'm telling you about, this Mote Equity also helps the small intestine not act like a snake moving back and forth, but moving things along and clearing things out. So I think it's an interesting medication to talk to your doctor about if there's constipation or gastroparesis.
Is it covered by drug plan?
It is. It's getting more and more covered. As long as the doctor puts down in the note, tried this, he tried this, he tried this, and none of it was effective. That's called prior authorization.
Right. I know.
Been there, done that. Right? All right, so we talked about the swallowing, the esophagus, the stomach, small intestinal overgrowth, constipation. The last thing I wanted to mention was the dyssynergic constipation, where the stool moves normally through, but once it gets to the bottom, it doesn't come out right. That's normal in people without Parkinson's. It happens all the time, mostly in ladies, especially ladies who've had hysterectomies. Because those angles in the rectum change, and it's harder to move the stool out. People strain and nothing happens. The reason that this is important is because the treatment for that one is not Amitiza or Linzess, it's biofeedback, where there are actually pelvic rehabilitation specialists in this town. Pelvic rehab, you put that in Google, pelvic rehab. There are folks who specialize in helping people retrain those muscles to work right in that kind of constipation. We can test for that. We have very fancy tests, very fancy MRIs, very fancy tests. But if that's the diagnosis, these medications will do nothing. You just need biofeedback. So don't let people start giving you medications if that's the problem. So slow transit and dyssynergic constipation.
You're changing your diet though?
Yeah. Listen, in my experience, I'll tell you things not to do. All right. No more popcorn. Lay off the almonds and the nuts and the pecans and the peanuts. Red meat takes 72 hours while cooked vegetables takes 12 hours to go through. I love steak too, it's just not good for us. Also, increase in colon cancer, it's been pretty much proven. So stay off the big T-bone steaks, cook vegetables really well. Raw vegetables will add to that small bacterial overgrowth much more than cooked vegetables.
Oh, really?
Raw vegetables no good for that. Cook your greens really well, your spinaches and any of the greens, especially if you go to the Asian markets, you get good greens, cook them really well. That'll move right through you. Flaxseed helps. Flaxseed oil, flaxseed ground up helps. Look, the bagels with the white bread, that's not going to help.
Ruined my morning.
I'm ruining everybody's day here, but the bagels and the cream cheese, no good for this particular problem. Don't give me a hard time over it. All right, you got to go to the store and get the sales on the blueberries and the raspberries, because that really helps.
Oh, yeah.
And here's the one that my grandma told me this all the time, and she was right. Prunes. But the best way to do the prunes is stew them. What's with these faces back there? You stew them in water for about 20 minutes, get them plumped up, because it has the water, it has the fiber, and it has a molecule called sorbitol in it naturally That's a stimulant laxative. So 2 stewed prunes a day is very low. In terms
Just has a lot of
natural-
sugar.
2. It's fructose. Come on, don't give me a hard time about sugar. It's not a cupcake. It's got fiber and water in it, so it's
What herbs help?
no idea. I mean, that's on I don't know. I never heard of that really.
What?
You'd ask about herbs, I don't know.
Heard one Casper cigarette.
Cascara is very hard to get these days. The only place I've ever found Cascara that you can still get, which is a very powerful stimulant laxative from the old days in the Bronx 80 years ago.
Are you talking about castor oil?
No, Cascara.
What's cascara?
Cascara is a stimulant molecule that used to be around very commonly. I found it in Whole Foods.
They used to put it in milk and magnesium.
Right. It's a very powerful stimulant. If there's a natural form of it, I found once in Whole Foods. You can't even get it at CVS or in pharmacies.
Does omeprazole at all interfere with absorption?
Well, remember, omeprazole is what we call a proton pump inhibitor. It completely shuts off acid secretion. When we do that, people get small intestinal bacterial overgrowth as a consequence of that, even without Parkinson's. Because those bacteria that we're eating all the time are not killed and they grow and proliferate. So I would suppose that the answer would be yes by that mechanism, but not correct. I will get to that in a second.
Yeah, I just had a question about you're saying about the cold vegetables. Like when I do salad, I did like the spinach leaves or whatever you call that, and then like carrots cut up. There's that. That's all bad because it's cold, right? Is that
Right,
what you're
because
saying?
it's easy in patients with any motility problem to have gastroparesis or constipation. So you're much better off with that salad, cooking those carrots, cooking those greens, using olive oil instead of heavy dressings with lots of animal fat in them. And that'll move through you. So those root vegetables, which are good for you, cook them really well.
Okay, thank you.
Probiotics. Who knows? I'm telling you, who knows? The studies are all over the place on these probiotics. There are certain diseases in my world where probiotics are indicated and proven by clinical trials to be helpful. But there are lists around that long, 5 or 6 of them. So in general, do they help? I don't know. Can they hurt you? No. Are they expensive? Yeah. So in my experience, the best probiotic is Nancy's Organic Yogurt. Anybody here of Nancy's Organic Yogurt? Get it at Sprouts. Look at the label on that Nancy's Organic
Nancy's
Yogurt.
organic yogurt?
Yeah, look at the label on that. Nancy's Organic Yogurt over it. I know Sprouts has it. I don't think Albertsons has it. But that one comes out of Oregon, and the bacteria in there are in the billions, and they're alive. Who knows what's in the little cap? But that's a couple tablespoons of that a day. That feeds your gut very nicely. It's cheap. It's $4.50 for the quart. It's not $40 for a box of little pills.
Wow, you know everything. You go shopping?
I go shopping for everybody.
Where are you located? Where's your-
Summerlin by Mountain View Hospital.
Oh, okay. You never come down here.
I don't even know where this place is. I don't know where I am right now.
So what's the big problem with popcorn and nuts?
They don't travel through the gut very well, especially if you have diverticulosis. Anybody?
Yes.
Listen, take it from me. No more popcorn.
Look 'em up.
Listen, if I have a bowl of nuts, I get constipated. So imagine your colon not working right, it's going to get impacted in there. And you're going to get into real trouble, especially with diverticulosis. Because if those little pockets get infected, you have diverticulitis. You have a problem.
But if you don't have diverticulitis, you can still eat nuts.
But just-
Moderation.
Moderation, not a bowl.
No, it's moderation. With that yogurt that you recommend.
You know. What time am I coming over? Sounds good.
Anytime you want.
Peanut butter. Peanut butter is Parkinson's.
Peanut butter's okay.
Can you eat peanut butter if you have Parkinson's? Is that okay?
I think so. I don't see why not.
No, of course.
There's a lot of people.
All right, that's it for me. I have no slides. I hope I helped you. Ask me any questions
You are
want.
terrific. I'm going to look you up.
What